Hello, wishing you all optimum mental health as we celebrate World's Mental Health Day today. My name is Susan Edamala and I am a clinical nurse consultant at the University of Illinois Chicago and an adjunct faculty at the Resurrection University Chicago, United States. It is my pleasure to be a part of the Voice of Healthcare today to celebrate the Mental Health Day. Our mental health is as important as our physical health, or shall we say it is even more important than our physical health because our physical health is dependent on our mental health. Our mental health impacts how we react to this world. It relates to how we handle stress and deal with people around us, be it our colleagues, our peers, our friends, or our family members. In fact, mental health affects every choice that we make in our lives. It affects every stage of our life from our childhood to adulthood, adolescence, or old age. No one is immune to the stress, and there must be no one in the world who never needed a support from a friend or a colleague when they were having stress or down with depression or anxiety. How do we maintain good mental health at an individual or personal level? Some of the things that we can do as individuals are creating a positive environment, selecting and practicing healthy lifestyle behaviors, expressing our emotions in a healthy manner, never keeping up emotions pent up, but cultivating channels to utilize them in a creative and effective ways, cultivating hobbies to channelize our energies in creative ways, taking vacations, enjoying life with friends, family in a periodic manner, being physically active, sleeping well, making meaningful contributions to the community, identifying our own weaknesses and developing coping skills to deal with those, practicing our faith. There is no substitution for faith other than faith itself. Faith teaches us to practice humility, be tolerant, considerate, and be grateful, which are all proven to be the best medicines for mental health. Last but not the least, seeking professional help timely if we need it is very important. So, we need to be aware of what resources are available to us. In the United States, at an organizational level, we have employee health services where we can utilize resources like psychotherapy, behavior modifications, and training, which are free of cost, and even our privacy is maintained. And so it is really safe for us to utilize those resources that are available at our hand. At the state and federal level, we have a lot of resources. For example, mentalhealth.gov is an online website which provides us with the resources that are accessible to us. Community-based nonprofit organizations like Mental Health America guides the public in relation to legislation, regulation, protection, funding, and research related to mental health. Being a professor in nursing, it is with pride that I present what we are doing at a national level at the schools of nursing in the United States. We believe that a healthy nurse is equivalent to a healthy nation. The deans of the nursing programs endorsed a new resolution known as a call to action for academic nurse leaders to promote practices to enhance optimal well-being, resilience, and suicide prevention in the United States schools of nursing. The facts that are put forth by this task force are that nurses are 2.8 times more stressed than the average American. Suicide rates are highest among the healthcare professionals. Workplace burnout is increasing by the day. Health professionals are the hardest hit during the pandemic of COVID. The everyday life of a nurse is filled with increasing clinical demands, prolonged working hours, poorly functioning teams, role ambiguity, inappropriate reimbursement, and not to mention the mere stress of just being in the PPE all day long while caring for the patients. So, how do we deal with these stressors that are very real and affecting our day to day lives? We can do a few things like building a culture of wellness rather than a culture of crisis intervention, offering mental health screening, providing support free of cost, conducting periodic resiliency programs, teaching lifestyle modifications to our staff, intervening early in cases of anxiety and depression, and implementing evidence based interventions. Remembering our ANA, the American Nurses Association Code of Conduct or Code of Ethics, which emphasizes duty to self before duty to others. I'm thankful to platforms like the Voice of Healthcare for creating an awareness at national and international levels, which is very important in maintaining the well being and the sustenance of the healthcare industry. Through your efforts, we are able to exchange knowledge and resources worldwide. We know how crucial the healthcare industry of any country is in maintaining the healthy, productive society. And it is indeed uplifting to see that the work of VOH in this arena. In conclusion, I'd like to say, as healthcare professionals, let us together instill a culture of wellness, look out for each other, support each other, and help each other because we know that healthy healthcare professionals are vital to our world. Thank you.